Discussing a new topic here at the 2011 ONS conference on Oncology.TV. Joining us is Lucy Mathew, an RN of 6 years at the MD Anderson Cancer Center in Houston, Texas. Lucy, thanks for joining us. Let's talk about your abstract, and it's kind of a unique one. Nurses' knowledge, attitude, and practice related to sexuality in patients with cancer. What is the evidence?
Yes, okay.
How did you conduct this study?
We found out that it is for most of the nurses have difficulty talking this topic to the patients. So we conducted a survey in our unit for the nurses to see how comfortable they are in dealing with this topic and how much they are achieving this. So according to that survey, we found out that 99% of the nurses are not comfortable, even though they know that this is an important topic and it is an important factor in the good outcome of the patient. Still they are not comfortable, so they were not dealing with this one with the patients. So we went through we did some literature review and this survey, and according to our findings, we conducted a in-service for the nurses in the unit, which was done by the sexuality education specialist in our hospital, which made the nurses more comfortable dealing with this.
Lucy, why choose this topic?
Yeah, I work in a urology unit, and there are patients having prostatectomy surgery, penectomy, so many other surgeries which makes them more feel invalid and which removes their self-esteem, and we came to know that they are more concerned about talking about this topic, but they are reluctant to. They are not confident to start the conversation. Neither the patients nor the nurses are comfortable starting the topic. So that is why, we know that it is an important topic. We wanted to bring out the opening for the topic. That's why we wanted to find out what is the barriers and how to overcome the barriers.
So you went looking in an area where a lot of people are more comfortable ignoring.
Yeah, that's true.
What was that like?
It was like actually the patients, they have so many questions about this which they are not willing to open up. They don't get a chance to open up. They don't feel comfortable to open up. And also the nurses, they have the chance to, they know the answers, but still they don't want to open up themselves. So from both sides there are barriers. So that is why we wanted to cross this barrier. We wanted to find out a way how we can cross this barrier.
So what's next for you in this particular area of research?
So the in-service which we gave in the unit, it helped a lot, and many of our nurses commented that was so helpful, and they feel more confident and more comfortable in talking about this topic to the patients. So now we are planning to have this in-service more frequently in the unit, so they will be more used to, and if it is a success in the unit, we want to bring it to other units also.
Lucy, thanks for spending some time with us and discussing your topic.
Thank you for bringing out my topic in front of others.
Very
Thank you
good.
for inviting me.
You got it. Lucy Mathew from the MD Anderson Cancer Center in Houston, Texas, discussing sexuality and oncology here on OncoView.tv.